अभी जो आपने सर्जरी देखी वो थी ICL की लाइव सर्जरी। अब जो नेक्स्ट हम दिखाने वाले हैं वो है कैटरैक्ट की लाइव सर्जरी। कैटरैक्ट, जैसे मैंने आपको पहले भी बताया है, कैटरैक्ट को हिंदी में सफ़ेद मोतियाबिंद कहते हैं। और इस कैटरैक्ट सर्जरी में जो हम लेंस डाल रहे हैं वो दुनिया का सबसे बेस्ट लेंस है, जिसका नाम है एल्कॉन विविटी लेंस। इस लेंस का बेसिकली एडवांटेज ये होता है कि ये लेंस आपको दूर की नज़र या दूर का डिस्टेंस, जैसे टीवी देखना, कोई मूवी देखना, घूमना फिरना, गाड़ी चलाना, वो विज़न आपकी बिल्कुल परफेक्ट होती है। बीच वाली विज़न, जैसे कंप्यूटर पे काम करना, लैपटॉप पे काम करना, मोबाइल पे काम करना, ये वाली विज़न भी बहुत अच्छी होती है। लेकिन जब भी आपको रीडिंग का काम करना है, पढ़ने लिखने का काम करना है या राइटिंग का काम करना है, तब आपको चश्मे की रिक्वायरमेंट पड़ेगी। तो ये दिखाता हूँ ये सर्जरी कैसे होती है, आइए देखते हैं।
Hello, sir.
The patient was very impressive performance of the lens that you talked about.
Thank
We had one similar IOL Vivity by Dr. Haripriya, and that also went on very well. So I was talking to the audience earlier that you are always been in the forefront of adapting new technology, new IOLs, and many other systems in the hospital. I know your son is also supporting you in that aspect of the hospital management and so on. So we all are looking forward for your surgery where you're going to use this Vivity with the toricity in it, using the new technology on the Centurion machine active sentry. So please go ahead.
Thank you, sir. So it's my pleasure to be here, and I invite you all to I7 Delhi, and we would be showing you two aspects of today's surgeries. One is the machine, which is the Centurion Active Sentry, and its advantages. A little bit of it has already been covered by Dr. Haripriya, and we would show you the benefits of the Vivity IOL. Especially in this case, we are doing the Vivity Toric IOL. So we all know that the Vivity Toric IOL is an EDOF IOL, and we'll talk about it as we go on to the surgery. So let's first move on to the surgical data, and then we move on to the actual surgery. So if you can just focus here, this patient is scheduled. This patient is scheduled for surgery right now, and we are doing Vivity Toric T3. The IOL power is 19.5. Now this is the Varion K data, 45 and 46 at 85 degrees. So the effective cylinder is 1.16 at 85 degrees. And the lens we are using is DFT 315. IOL power is 19.5. So we come to this now. So the IOL is going to be placed at an axis of 85. The incision is at 180, and the lens is DFT3. So T3 is the same nomogram which we used for the previous toric lenses. DF stands for depth of focus, and 15 probably stands for the expected amount of depth of focus in terms of diopters. So about 1 to 1.5 diopters of depth of focus. So let's move on to the surgery. But before the surgery, let me just show you, we are using the Varion technology, the digital axis marker. And the digital axis marker is placed at an axis of 85 degrees. Let's move on to the actual surgery. So the first step is to capture the digital image on the eye. Okay, registration done. Next. 0180. Next. This is 85. So even though a digital axis marker is a markerless technique, but for the sake of live surgery, I am going to place a junction violet mark here so that during surgery the audience can relate to this position. हटा दे. Okay. So the cataract surgery is a regular MICS surgery using the Centurion active century system. थोड़ा लाइट पे देखो सामने. सामने ढीला छोड़ दो अपने आप को, बिल्कुल ढीला छोड़ के रिलैक्स कर लो, कसना नहीं है बस. The side ports are 1 millimeter. The main incision is 2.2, and the lens preparation is the same as we would do for a normal IQ lens.
It's good to know that there's no difference between IQ and Vivity on the table. You do exactly what you would have done otherwise. So that's a good point that you made. That's good.
So the field should be clear of air bubbles. Even the tiniest of air bubble becomes quite a distraction at times.
Somebody is talking, please switch off the videos. The audio.
Okay. So till this point here, there isn't really something different. And now what we would use is the balance tip. Okay, already रखना और है ना ready? Using the active century. So on your screen, if you see on the right side where the parameters are showing, at the bottom is AF. That stands for active century. And this is the balance tip. Dr. Haripriya and other doctors have very well shown this. सेंटरिंग कौन देख रहा है? सेंटरिंग कौन देख रहा है?
So I thought the shots that you produced were very, very good. And I believe that because you have the right vacuum over the fusion and the perfect the movement of the shot, it's totally valid in the studio. And in the single chamber all the time.
So I'm using a low IOP, but not very low either. It's about 48.
The 48 is about 65 or so centimeters more than height. It is not very much tall. Less than 70 or so. But now is the time when the scottons are removed, look at the chamber stability. And that's primarily because of the extra fluidics and ability to maintain the IOP, but also this newer technology of active where it dissipates the surge. The event happens after breaking the fluid. It is quicker in response, so you will not notice as frequently as you would otherwise see.
So how much is the energy that you have used, sir? This is? 3.
It is only three, this is nothing.
Okay. इसको दो.
But more than that, it's very good that you use less energy, but more importantly, it was so much controlled procedure, the chamber was so stable, and I think your probe was always in the middle and nothing happened to the eye of it. So this was very good, this was more impressive.
Thank you, sir. So we had a rock stable chamber.
Very, very stable, rock stable.
With other phaco tips, maybe the energy would have been higher, but with the balance tip, it is about 40% less than other tips.
So I think this is very true, and that's because of the spatial patented shape and design of that particular piece that uses the causal part of the phaco movement, so peak movement so well. With less bones or less heating at the incision.
थोड़ा ऊपर बिस्कुट डालता हूँ. सामने देखो बच्चे लाइट से. बच्चे आप कस रहे हो बार बार आँख, बिल्कुल ढीला छोड़ दो, सामने देखो, पॉलिश. So we still see a lot of debris on the posterior capsule. If you'll notice, I'm switching over to the retro illumination, totally retro, and at this illumination, the capsule and whatever remnants on it come out so clearly. Change karo, polisher. Polisher change kar tip.
But with this kind of imagery, they look not that good, but in reality, if you see next day, even if you don't do anything, they're not that bad at all. They won't bother illusion or they won't impact the vision very much. Actually nothing because it's not really reflective. So it's good to clean it up, but if you cannot for some reason, it's not a big deal. But your device, this manual stick you have, is I believe sandblasted.
Sand-blasted tip, sir, with the fluid coming in from the center. It keeps the chamber very stable, and I've taken away all those little remnants which were there.
Okay, very good, very effective. And without distorting the incision, without creating folds in the cornea, you went to the main incision, and with the sighting movement, it was so clean.
So you need an air bubble free area and lens. So this is the lens. It looks just like any IQ lens. Nothing special. When you're seeing it under a microscope, you can see those 3 dots on either side under the haptics, just where the haptics are meeting the optics. Those are the toric axis. Other than that, at this moment, you really don't perceive anything special. But then let's see when it goes into the eye, then we'll talk about its special optic complex that gives it all those unique properties that we are looking for in today's world, today's technology, and all those features that call it the lens of the generation. So, handling properties as good as the IQ, very smooth, undisturbed. This kind of injectable properties are very unique to this platform.
I like lenses unfolding very slowly, so that even if there is a big capsule or a luxury capsule or a small piece of the shell or something, you have a control on the IOL implantation. So this is the nature of this particular lens.
So now in any toric lens, it is important to remove the visco thoroughly, both in front and behind the IOL, especially behind the IOL, because even though this IQ type lens has a little sticky nature and it sticks to where it is left, but still if there is visco in between or any other fluid in between, the lens could have a possibility of rotating slightly. So how do we remove this visco? We just go to the side, go under, lift up the edge. Remember, it should always be the irrigation that should go under, never the aspiration, because the irrigation is pushing the posterior capsule behind, away from the tip, and aspiration would pull it towards the tip, and there is a risk of damaging the posterior capsule if you have an irrigator behind the optic. So almost visco gone from behind. Now we have to rotate it into position. Stop a little short. And now, before I reach there, I'll show you the optics. Can you see that optics in the center against that reflection?
You can see very well. You can see very well.
So this is, abhi nahi chahiye, hatao. So this is what this lens has, which has become the talk of the ophthalmic community. This zone is 2.2 millimeter in dia, and it has two zones. An outer zone which is raised by 1 micron, and its effect is to delay the wavefront. So the outer zone is like a plateau. The inner zone has those curvature changes that stretches the wavefront. So with the combination of the outer and the inner optics in the 2.2 millimeter zone, this optical complex has the property of stretching or elongating the wavefront, and therefore this lens is capable of a good distance visual acuity like any monofocal, an intermediate vision, and a functional near vision like you saw in the video or the testimonial just before this procedure. So now we are almost on axis, and before coming out, I press the lens against the posterior capsule so that its tendency to rotate is the least.
I think what Sanjay said, if I repeat, this changing the shape of the wavefront that creates a kind of a tunnel of good vision all throughout the tunnel, unlike the other technology, so-called EDOF.
सामने देखो बच्चे, फ्लोट दो, वो दिखा दे, इकरा, लाइट पे देखो बच्चे, लाइट पे, until the macula. So that's why this lens has a uniform continuous intermediate to quite a good functional reading these. And very there are no jumps. And now if you see, the lens is perfectly on axis. At 85 degrees, the 3 dots on the right and the left are bang on. So this is what we desire in a surgery like this.
Thank you.
सामने देखो बच्चे, ऊपर से हटा दें. So now if you look at the properties of the machine, so machine, the active sentry has a special feature, and the special feature is, go handpiece दिखा, this handpiece which you see here, this handpiece, the sensor which controls the IOP in the Centurion system was always in the machine, the basic unit behind. And so by the time the IOP changes happened and reached the sensor in the machine, there was a lag. So there could be some mild surges. Of course, Centurion controls them very well. There could be some mild surges, but in the active sentry, what they have done is, they have brought the sensor in the handpiece. So because the sensor is there, any earliest changes of the IOP in the eye are immediately sensed by the sensor, and the rectification process takes place immediately by the machine. So there are two main advantages of this, two main outcomes. One is what is called the active surge control. That means that whenever there is a surge, then the sensor detects and does a rectification. But if your sensor is very close to where the activity is happening, if your sensor is very close to where the activity is happening, then I'll just come to the dash here. Even before the surge starts, the rectification process starts, and we don't get a surge. This may not be so obvious in surgeons who are working with normal parameters, but surgeons who are working with high vacuums, high flow rates, and also surgeons who are working with low IOPs and high vacuums and flow rates. There, this mechanism is very useful to keep the chamber stable. Along with this, it also has an inbuilt system. The new active sentry system has an inbuilt system which compensates for any leakages in the incision. So now how that system works is, the machine is sensing what is the fluid going into the machine and what is the fluid coming back to the machine. And if there is a deficiency, that is labeled as leakage. And then there is the immediate leakage compensation. The machine decides how much of leakage is happening through the incisions and presses the plate to compensate for that loss of fluid through the incision. So there is leakage compensation. So these two features gives the machine an added advantage of the previously existing Centurion system. Technology is improving, it is upgrading, you are getting more control on your surgeries. Your chambers are very stable. Now you can work on very low IOPs of 30 and still rest assured that your chamber will be stable and the whole situation would be in your control. You would not get surprises or the least surprises. So the machine would show how much of ASM, that means actual compensatory mechanism is happening. So here if you see this, ये चश्मा हटा देना मेरा बेटा चश्मा हटा दो. So active surge mitigation it is called. So ASM, active surge mitigation, happened twice in this surgery. So I didn't feel any surge at all, I didn't feel any chamber instability, but the machine was working and it used twice this mechanism to keep my chamber stable during this live surgery. Other things is total CD was 3, which was remarkable, really remarkable for a whole cataract surgery. The total US time was just 21 seconds and a lot of other parameters, which is showing that how the machines are improving day by day, helping the surgeon do better and better surgery in not only normal but complicated situations. Thank you, sir.
It's rare. But thank you, everybody. Thank you, and
Thank you so much, sir. Thank you. That was a very educational session, and thank you so much for your time and for your contribution. And thank you, Alcon, for doing this. All the surgeons from the various cities, Chennai, Mumbai, and from Delhi, who connected for this unique scientific program. We had a multi-city live surgery demonstration, I think for the first time indoors. So thank you so much, sir. Thank you, and thank you.
Goodbye.
Thank you, Namrata, for a wonderfully organized session, and thank you, Dr. Rajendra Prasad, for chairing it so well. Thank you, Vasavda, sir, for everything. We had a lovely Alcon session.
Thank you very much,
Thank you,
Sanjay.
Sanjay.
Thank you very much.